Welcome to the first inaugural Sunday Summit. I am going to share this first series, which is about my skin removal journey and what brought me here and how I've learned to pace my heart. And hopefully through sharing my story, it might give you some tips or thoughts about how to pace your own heart in this complicated world. Maybe not health related, maybe soul related. So we'll go on a little journey here, climb the summit on a Sunday and see what valuable tidbits you might take from it. So as I said, this is going to be the first summit in a series about my skin removal surgery. I leave in a few days for Los Angeles, which is where I've chosen a surgeon, Dr. Charles Galanis, to do the first stage of skin removal. But I thought at this point, I'll just share what brought me to today. It's been more than just your standard weight loss journey, in that it's been a real long health journey for me. So I'm going to start way back. Just for reference, I'm 54 today. But when I was 31 years old, we discovered I had a brain tumor. It was a pituitary tumor, non-secreting adenoma. It was large, macro 13 millimeters. And at that point, it was pressing on my optic nerve, and I had started to lose my peripheral vision. My daughter was just about a year old, and it was just a really good catch by my family doctor, honestly, in that we were in for a checkup for my daughter, and she was asking me how I was feeling. And I said, I was trying to return to work, but I was struggling with headaches, and my milk, because I'd weaned my daughter at about 8 months, was not drying up. And she said, you've never really discussed headaches with me, not even when you went through fertility treatments for your daughter. So this is something new for you. And I said, oh yeah, it is, but it's hard having a young child. And I had a husband at the time who traveled a lot for business. So I was a single parent much of the time, and returning to work, is its own pressures. So I was fairly quick to write it off, but she wasn't. And she said she just wanted to do some lab work and check a couple of things. So that's what we did. And my blood work came back that my prolactin levels, which are usually the indicators of your milk supply, were quite elevated, but not as elevated as you would often see with this type of tumor, actually. But in just a real, sense of being cautious, she suggested that we do a CT scan. So I said, whatever you think we need to do, that sounds good. And then she called me and said that it was going to be about 6 months, and she didn't feel very comfortable with that. So would my husband and I consider paying out of pocket for one to expedite it, and she could get me in within a couple of days to a private clinic. So I discussed it with my husband, and he said, yeah, we should probably do this just to rule it out. So I went, and unfortunately it came back that I had this fairly large tumor growing in my brain. So we quickly had to rally and find a surgeon, and where I was going to come for surgery even, because at that time we lived in Lacombe. I'm from Calgary. I grew up in Calgary, but we have moved there for my husband's job. And so we made arrangements to come to Calgary for the surgery. It took a few months to line up, and I had that surgery. And that was the start of kind of realizing that I had some serious health issues. I had gradually been gaining weight over about a 5-year period at that point. It had been fairly slow, but gotten more pronounced as I went through fertility treatments, which can happen. Weight gain can be an issue. And we didn't have really good hormonal numbers for me pre-surgery. So hormones usually can really vary between person to person, and what is one person's normal could be quite different for someone else, and we didn't have that benchmark. So we really were just dealing with my hormone levels, and while they were low, they were still functioning. And the way that your thyroid particularly works is if you add medication, it becomes reliant on it and it stops producing the hormones that it needs to. So it's considered sort of a last resort if needed. The type of tumor that I have there is a high risk of it returning when it's that size. Thankfully now I'm, as you can tell, over 20 years past that point, and I haven't had a recurrence of that particular tumor. So I've been quite fortunate because the return rate they thought could be like as high as 50 to 75%. So I've been very lucky. But putting me on a synthetic thyroid medication, which would help with weight gain and hormone issues, was sort of a last resort in my endocrinologist's point of view, because if a tumor came back and my thyroid ceased to function, that medication would be my only lifeline. And if I used it pre-surgery and it was ineffective after another tumor, that would be life-threatening for me. So she said that was not a risk that she felt was worth taking, considering I had a child and wanted to have another one at that point. So I had to frustratingly live with my increased weight gain over the years. I did go through fertility one more time to have my son, and that was considered a bit of a miracle. They weren't sure if I would be able to have another child. So that was absolutely fantastic. I'm very happy to be the mom of two. But yeah, it was very hard for me, as a person who had never been plus size as a child or growing up, to suddenly feel that lack of control. But you make the best of things. Unfortunately, weight comes with a lot of stigma. So a lot of people correlate weight with poor habits or lack of motivation, those types of things. And while I knew that wasn't the case, and those that love me knew that wasn't the case, it's still how the world perceived me. Especially 20 years ago, I think we've come a long way in education about weight, and that it is often just symptomatic of other health issues. And mine became a lot more profound as time went on. So basically, I enjoyed my life to the best of my ability. I tried to stay active, and I started to have more health issues. I ended up having a hysterectomy and my gallbladder out, and some colon surgeries. I really was struggling quite a bit with my health. And it got to a point about, I guess it's 7, almost 8 years ago now, that I really wasn't feeling well. I was struggling to stay awake. I would fall asleep almost in conversations. And I was going to my doctor, and the answer at that point was, well, you should eat less and move more, which is very common. We've heard it a million times at this point. And I felt very frustrated. So I just really started to eat very little and sleep a lot. It really was a struggle for me. My days were really bent around just trying to get my kids to school, to their activities. I would sleep a lot during the day and then have to drag myself to get my kids after school and get them to activities. I had to steal my energy to go get groceries, usually once a week. It became a pretty big struggle, especially in probably the year before a heart tumor was discovered. So, and how that heart tumor was discovered, was one evening, or one night, I guess I woke up in the night and I thought I couldn't breathe. And I realized I was breathing, but that my heart was racing really fast. And I'd had periodic bouts of this probably through the last 6 months, quite recurrent, but they would come and go so quickly. I just didn't think much of it. It didn't cause me any pain. I just felt tired, and I would usually fall asleep afterwards, to be honest. And the same sort of thing happened that night. I was awake. It lasted maybe 5 minutes, and then it stopped, and I was just overcome with fatigue, and went back to sleep. And I had plans the next morning to do something with my husband at the time. And he was always an early riser, and I was less so. So he let me sleep, and he came in sort of mid-morning and said, are you getting up? And I said, I'm just not feeling the greatest. Just give me maybe another hour. And he looked at me sort of concerned, and he said, okay. His motivation, I think I said, was not really my issue. If I was planning on doing something, I would figure out how to steal my energy and do it. He came back about an hour later and again woke me up and said, okay, like, it's lunchtime. What are you thinking? And I said, I'm not feeling great, but I'll try. And he said, what's going on? You don't look great. And I said, I just had this weird thing happen in the middle of the night. I thought I couldn't breathe, but my heart was just beating really fast. And he got a little alarmed. He says, well, heart? I'm like, yeah, but it doesn't hurt. Like, there's no pain. I said, I just was tired. And he said, well, that doesn't sound great. Maybe we should be going to the hospital. And I said, I just don't even know if I have the energy to get up and shower. I think I just need to sleep. So I said, okay. So he left me again for an hour or two, and he came back, and it was early afternoon. And he said, I think we need to take you in. And I said, I don't know. I don't want to spend my day in the hospital. And he goes, I just think we really should. So, and he's not a hospital guy. I'm not a hospital person. I think most of us avoid it if we can. So I said, okay, well, let me at least shower. So I showered, and we went to the ER, and we got there, and, we waited in line until we saw the nurse. And the nurse said, why are you here? And I said, I had this weird thing happen. I said, I'm feeling fine now. I'm just really tired. So she said, well, we should probably do a heart tracing on you. That's when they kind of hook you up to a monitor. And she immediately said, you're feeling fine? And I said, yeah, I feel absolutely fine. I'm just really tired. And she said, okay, well, I'm just going to take the strip basically and show a physician. I said, okay. So she took the strip, and she goes, yeah, we're going to take you back now. Oh, okay. Still don't really recognize what's going on. And a doctor came very quickly, and he said, so you're having some electrical rhythm that's very elevated. He said, how are you feeling? And I said, this feels fine. Like, this is normal. He goes, this isn't what you felt last night. And I said, oh no, it was much faster than this. And he said, much faster than this. And I said, oh yeah, much faster. And he said, So my resting rate at that point was in the 180s. So that's what a lot of people get to when they're jogging, basically. And then while I was talking to him, it clicked into that rhythm, and it reached 297. And it's hard to explain, but when it races at such a velocity, I guess, you can actually see it through your chest. And it physically was moving my body. Like, I was rocking back and forth. So he said, I'm not sure how you're conscious. Most people, if they had a rhythm like that, would pass out. And I said, this feels like it felt last night. And I said, I've been having periods of time like this, but they were shorter than what last night was. And he said, you're having this regularly? And I said, yeah, fairly regularly. And he said, okay, well, this is something called SVT, supraventriculitis. I always get it wrong. SVT. Let's just call it that. And it's really when your electrical rhythm runs too fast. So he said that sometimes this can happen. And usually what they'll do is do what they call a cardioconversion, where through IV they inject medication and then it stops your heart and resets the rhythm. It's like a hard reboot, basically. So he said, I think we should do that, but we have to get you in a certain area because we need sort of like a crash team around while we go through that and certain personnel. Okay. I'm feeling fine at this point. Again, just very tired. So they get me moved into this more emergent zone in the ER and get me set up on IV. And it takes a while. It's a Saturday night by this point. There's lots of activity in the ER, lots more, I don't know, patients that have gone through, a major accident. And here I'm calmly sitting, feeling just fine. And it feels like I don't belong here. I'm not sure why I'm in this place, around all these types of people. But they set me up and we do this cardio conversion. They tell me that it's probably going to make me feel really unwell. Some people actually throw up afterwards. But basically your body just shuts down for a few seconds and it reboots. And they did it and mine didn't shut down. It was still going. So he said, okay, well, that's a little unusual, but we start at a half dose and then we go up to a full dose and see how that works. And so they did that and it still didn't reset. So he said, okay, this rarely ever happens. He said, we can do one more dose. The protocol is 3. And he said, we can do something where we elevate your feet and tip your head back. He said, again, it probably isn't going to feel very good, but he said, I've never known this not to work since, I've been in ER for over 20 years. Okay. So we do that and it doesn't reset. So he said, okay, well, I've tried everything that I can, and now you really need to see cardiac specialists because I'm not sure where we go from this point. Okay, sounds good. So then a cardiac physician comes over with a resident and says, okay, so there's definitely some electrical issues there. We're not sure what's causing it. We'll probably discharge you and get you in with a specialist, and then they can run more tests since you seem quite comfortable and you're not in any pain. And, they'd already sort of determined I hadn't had a heart attack from blood work, that type of thing. I wasn't having a stroke. Okay. And then the resident talks with the doctor and she says, so the resident here, he's maybe going to try and drum up a ultrasound machine and maybe do an ultrasound while we get everything arranged for discharge. Okay, sounds good. So it takes him a little while and then he comes over and he says, sometimes women your age, there can be blood flow issues. He's like, that's sort of what we're thinking it might be. So I'll just do an ultrasound here and see how that goes. So that's what they did. He just started doing an ultrasound and he got real quiet and he's watching it and he said, do you mind if I use my phone to record this? This is an old machine. It doesn't have record capabilities on it. And I want to be able to record this and then show it to the doctor. So, I said, sure, go ahead. I said, is it what you thought it was? He goes, no, it's not what I thought it was. I said, oh, okay. He's like, there's something here, but yeah, I'll just keep recording it, see if I can get better pictures. Okay. Still, I'm feeling fine. I don't know what to make of it. Still thinking, this is a chaotic place and I just want to go home because I'm very tired. So he said, well, I think I've got what I need. I'll be back. Okay. I haven't at this point gotten discharge papers or anything. And then he runs over to that cardiac physician, and she's very busy. There's other people around here, her trying to talk to her, and he sticks his phone under her face and immediately gets her attention. And my husband and I are just kind of watching this happen. And I said, oh, And my husband says, yeah, there's something there, hey? And I said, I'd say so by that reaction. So then she takes him by the arm and they go in a different room and start talking. And they come out about 15 minutes later and go behind the desk and start making calls. And then she comes over and she says, so it looks like we're going to admit you. And I said, oh. I said, so it wasn't the blood flow thing? And she said, no. She said, unfortunately, you have a tumor in your heart. She said, and it's quite large and there's very little blood flow. We're not sure actually how your body is still functioning at this point with the size of this tumor. So it needs to come out quite urgently. She said, it's going to require a team. They're going to need to consult and figure out how to approach it. And she said, you'll need an echocardiogram. And because of it being a night, she said it won't be open again until the morning. So we need you to stay in this bed. You're not going to be able to get out of bed. We'll have to keep you on a monitor and get you admitted. And you won't be going home until you've had surgery. And it was like, whoa, okay. She's like, I have to be honest, this is very serious. This is very life-threatening. And we're going to do everything we can to help you through it. So that was quite a big shock for both my husband and I, for that to sort of sink in. But yeah, you don't really have a choice in those types of moments. You just have to trust you're in the right hands and you came at the right time. And, I had a lot of will. I had 2 kids at home that I love dearly. And, I just felt like I've survived for a reason and I'll continue to survive. So it took about 6 days until I had surgery. The next morning I did the echocardiogram so that they could map it out. And then they needed to go through a process of giving me heparin medication in my arms, which thins your blood, which makes it easier for you to go on bypass, ECMO. And they also spent quite some time discussing the best way to approach my heart, because it's a difficult surgery. And they also discovered at the same time that I had a hole in my heart, which I'd been born with, that hadn't been diagnosed, that needed a repair. So their goal at that point was just to try and do it the safest way and try and get the entire tumor out and any margins around it, so that it wouldn't regrow. And the surgery was about 7 hours. And I came out of that already, I was in pain and I was very groggy, but even being very medicated to keep me comfortable, I was already feeling somewhat better having it out. But my heart was still going into these SVT rhythms on and off. So it took quite some time for me to get out of ICU and step down ICU. I ended up being in there almost a month while we figured out medication to keep my heart more regulated. It was like it needed to be retrained. It was used to running at such a high speed that it wanted to revert to that, like it didn't know what normal was. And it was taking time for medication to sort of retrain it into a new pattern. So my surgeons, he was amazing, and he came to see me and he said, how are you doing? And I said, I feel like I have more energy, even though I'm still having these bouts that tire me out. And he said, well, hopefully in time with working with your cardiologist, you'll figure out the right medication mix, and that will help regulate it and get it trained into a better rhythm. He's like, you have a very healthy heart. It's probably been running for 5 years plus. So my heart was constantly in a state of, we're working out. So he said it was very strong. He said it didn't want to shut down, and it still didn't want to slow down. So I guess that's the good news, was all that extra rhythm made that muscle real strong. So that was good. And then we just talked about my general health, and he said, what do you want? He's like, you have survived something amazing. He said, I feel like whatever your goals are now, the sky's the limit. And I said, well, I really want to regain my health. I said, I was never a plus size person, and this has been really hard for my self-esteem. I really haven't felt like myself in so long. And he said, well, I think a lot of the health issues you've been diagnosed with could have been related to this heart tumor. Like, I had been diagnosed with lupus, and he said, I think all those things that created that diagnosis, he said, may have stemmed from this tumor. So he said, you might want to revisit that. And he said, you've not gotten proper support regarding your weight and gain. He said, obviously your organs haven't been functioning at the right levels for many years. And he said, it will be interesting to see how, as everything improves health-wise, how that affects your weight and your ability to be active. He said, it's going to be a long, slow climb, but he said, I can tell that you've got a lot of will to live, and I think you'll get the right supports around you. And that was really vindicating for me, to have someone say that, really I'd been a victim of my own health, and it hadn't been recognized, and that I was going to have the power to make different choices. So I looked at, the physicians that I had in my care, that I was in their care, and realized that I hadn't gotten proper attention. I was seeing a family doctor who was training other doctors, and I couldn't get in to see her specifically, so I was kind of rotated for the last couple of years through different students. They just really weren't capable of diagnosing or even giving me the time to listen. They saw me as a middle-aged mom who probably ate too much and wasn't active enough, and they didn't dig any deeper. And that's really sad, because I think a lot of people don't choose to have extra weight. And I mean, it might not necessarily be a physical issue, but maybe it's a mental health issue. Maybe there is some food addiction there. There is a cause. Nobody chooses to be unwell. They just don't. I don't believe that. You choose something for comfort, potentially. Maybe there's some other things that you're avoiding. So you're not choosing the healthiest path in life for you. Maybe you're on medications that affect your weight that you need because they're life-threatening. Whatever it might be. We make a lot of judgments because weight is something that you can't hide. It's not easily hidden. So I really dug in and got myself new doctors. I got a new family doctor. I actually chose someone who was an absolute new grad. I called I had a list of 10 doctors that I had researched, and I called 6, and I went and saw one, and she said the right things to me. She said that admittedly she was a new doctor and she didn't know it all, but she was a very good collaborator, willing to learn and work with other doctors, and that she wanted to help me. And that's what I needed. I absolutely needed someone that didn't think they knew it all, that actually wanted to go through this journey with me. And she's been a fabulous doctor, and she's still my doctor today, and she became our family doctor. And she's really been true to her word in lots of scenarios now, because I have a multitude of doctors. She is very much a team player, and she doesn't ever say that she knows it all. She's always eager to reach out and get a second opinion. We don't rush making decisions for me, and I appreciate that. So following that heart tumor, I lost about 40 pounds in the month that I was in the hospital, just in water weight. Incredibly, like my legs were so swollen. I'll put up a picture here so you can see, the size of me. It's hard to believe, but I was 401 pounds at my height. That's what I weighed in before surgery, because they had to weigh me for anesthetic and medications and all those types of things. So I lost 40 pounds there, and then the year following that, it was a real slow progress of getting my heart retrained to more regular rhythm with medication, and then figuring out medication balance, because a lot of medication makes you drowsy and tired. So trying to balance what would keep it regulated enough, but also give me enough quality of life to be active. And I just gradually increased my activity until I had better control of it. And it took a couple of years, and I lost about 100 pounds. And in that time, I started working with a dietitian because I'd always had a lot of gut issues, even from a child, and I had never really figured them out. I tried naturopath, we tried eliminating dairy and gluten and so many things. We did 3 different biopsies because they really felt like all my symptoms pointed to celiac disease, but they came back negative. So we knew there was dysfunction, but we couldn't really prove what it was. And I had just gradually stopped eating very well. I just wasn't eating enough quantity. So the dietitian started working with me on figuring out higher protein and to start consuming more calories, because I was only consuming 1,000, 1,200 calories, and that wasn't enough. Even though at that point I was still plus sized, crazy at that amount. But we kind of worked on things. I still continued to have stomach issues, and I had colon issues where I had a few surgeries. So it really made me want to try having a surgery called gastric bypass. So a lot of people, that is a weight loss tool where they disconnect your stomach and just create a pouch out of your small intestine. And I felt like my stomach just had never worked properly. But with all my health issues and that I'd already lost 100 pounds, usually you can lose about a third of your weight through this surgery, but often your metabolism has a bit of a set point and it doesn't let you lose more than that. So this surgery wasn't really, I hoped I could lose more weight. I didn't know if I would be able to. They sort of warned me that, if I lost even another 20, 30 pounds, I'd be fortunate. But that I couldn't go into it thinking it was going to be a big weight loss tool for me, given my health complexities. So they had me meet with the head of the bariatric surgery program, and he went through my file, and he said to me, "So I've read your file," and he said, "I think you've been through so many things that this is maybe not a good choice for you." And he said, "Because there's definite risk," and he said, I would worry that you would need to be tube fed following this." And he goes, just something you're not really going to want at your age. Most people don't want it, period, but you've got children. I don't think this is something that you want to do. And I said, well, I hope that you'll hear me out. And he said, of course, like, that's why we're meeting. He said, I want to hear from you. He said, like, I do recognize that you've been through a lot of surgeries and a lot of life-threatening situations. So I want to hear from you. So I said to him, through this all, I said, I've really wanted to fight to regain my life, and I really feel like it's possible. But I really feel like, for whatever reason, the stomach that I was born with does not function properly for me. And I said, I feel like if we can take that out of the equation, we can really see what food I can tolerate and have a better quality of life. And we had a really long conversation. He gave me an hour of his time, amazingly. In the day and age where we get 10 or 15 minutes usually with a doctor, we had an hour. I mean, my file's quite thick. And he said, okay, I can't believe, at the end of it, he said, I can't believe I'm saying this, but he said, you've changed my mind. He said, that doesn't happen very often, to be honest. He said, for whatever reason, he said, I feel like what you have said and how you've thought about it, you should have the ultimate decision in this. And he goes, if anyone can do it, I think you can. He said, I think this could be a real fit. He said, I don't know what the outcome could be. And he said, I've never done a surgery like this on someone with your health complexities. He said, but if you really want to do this, he said, let's do it. He said, I really want you to continue to work on your fitness and eating well. And he said, you have to follow the dietitian. I want to know that you're eating the calories that you should be eating. You need to go into this surgery strong and healthy. So it takes quite a bit of time. You get on a list. Some people, it can take them 2-3 years to get in for surgery. So I was lucky in that it took about 6 months. It felt like forever, but I continued to work on my eating and my weight. And at this point, I was doing aquasize at the pool 3 days a week and really enjoying that. And I was down about 120 pounds before surgery. And we had surgery, and he said it went so well. He said, I didn't know what I would find. He said there was scarring, because I'd had hysterectomy, I had had gallbladder surgery. He said, what I expected. And he said, I still had fears that it wouldn't be safe. And he goes, but it was. He said, it just all went well. So that was excellent. And I recovered pretty well from it, to be honest. A lot of people can really struggle with it. There's a lot of eating restriction following it while you learn how to eat. So I don't drink and consume food at the same time. That's too much stress for my pouch. It likes to either be consuming food or drinking fluids. So I'm careful about that I space them out, and worked again with the dietitian. We trialed foods that we knew worked for me before surgery, and gradually integrating them. I'm very good at making sure that I prioritize protein and vegetables. I've learned that I can only usually consume raw vegetables in smaller amounts because I have a condition with my colon called diverticulitis. So it prefers to have things a little bit softer. So roasted vegetables are better for my particular gut than a lot of raw veggies. So we worked on that. And because I need more protein, we've learned that I can handle more lactose-free dairy. So I've done things like that. And I continued to lose weight, which was great. I managed to lose about another 100 pounds. So my surgeon was thrilled with that. My doctors were thrilled with that. And I still wanted to see if I could get to my ideal weight, which to me feels about 130. That feels good. So I went on Ozempic for a while. And then I sort of went past the benchmark a little bit and got a little extra light, which was last winter, I guess. And so I came off it. At that same time before that, we discovered that I had another heart tumor. Just as I was leading up to go see a plastic surgeon, because I'd finally felt like I had reached my goal, we discovered in the testing that he required that the tumor had grown back, unfortunately. And very rapidly, because it had been 9 months since I'd had an echocardiogram, and I have them every year. And it had grown to almost the same size as the original one that they thought had taken at least 5 years to get to that size. In 9 months, it had gone from undetectable to almost the same size. So that was a bit of a shock. And once again, here I was going straight into the hospital, and waiting to have that second tumor removed. So I did that, and then two months post that surgery, I had rescheduled my trip to go see the surgeon, Dr. Charles Galanis, and I had to thank him. He saved my life, which I didn't even realize was in peril at that point. But we kind of talked about my goals and removing some of the skin, but my heart at that point was still not steady enough. I was still struggling with SVT. So it was really just okay, I'm here. I've got my body in the shape that I want it, but I don't have a ready heart. It just wasn't in a place that was stable enough for surgery. And unfortunately, we just couldn't get it straightened out with medication. We tried, but we couldn't find a balance. I went through 4 or 5 medications, and they either made me too dizzy or they didn't work. I was just having so much SVT. I would have it multiple times in the day. I was ending up in the hospital just about at least once a month to have a cardio conversion. And the doctor said, okay, we're getting to a point where the medication that we use to do the cardio conversion may stop working. And I went in, and sure enough, it was starting to not work as well. And at that point, then the only thing that they can do are paddles and pray, really. So I got expedited on a list to have an ablation surgery, and that's where they go in and they burn off currents that are most likely, which they show in a lab setting, are firing off and putting you into these rhythms. So when they were in there, they found I had 3 different lines, 2 SVT lines and 1 atrial fib line. So they could see which was the most prominent line, and they dealt with that. But unfortunately, in that process, I coded 3 times. So they really felt like my heart couldn't withstand trying to reach those other ones. An ablation surgery is usually fairly straightforward, and can take like an hour, 2 hours. And again, that ended up being like a 5-hour surgery for me, just because it became so complicated. And they also didn't want to bypass. They would have had to come in a different place, or else they would have disturbed a patch that was already in my heart. And they felt that that was not a good choice to weaken it when it was already struggling. So we've dealt with 1 line. We know that there's 2 in there still. I deal every day with irregular beats, sometimes some real short spurts of SVT. I'll feel for even less than a minute, and then off I go. So it does make me tired certain days. I just can't do everything that I want to do, which can be frustrating. But I'm still really grateful for my life. I get to do a lot of great things. Through this, I've had a lot of great people in my life, and I've mostly been able to maintain my health and fitness. I can certainly walk as much as I want. The SVT doesn't come on for any specific reason. I can feel it in bed, or I can feel it sitting in a cafe. It's not when I'm walking or trying to be extra active necessarily. It just does its own thing. It has its own little happy rhythm, I guess. But it is at a place now that it's not out of control. I'm not needing cardio conversions. It's nicely resetting it on its own. So my cardiologist and the electrophysiologist who did the ablation say, as long as I'm comfortable with where it's at and the function that it gives me, then we won't do anything, because it's risk versus reward. Every time we go in there and we do something, we are weakening my heart. That's just the reality of it. So I really have to think whether I want to go through that, and whether I think it's going to give enough improvement. Right now that I'm not having to have cardio conversion on a regular basis, that's a real big win for me. I still have to kind of monitor how much I do. I know if I have a real full day that I need to bookmark that with a quiet day. And as I've gone through a divorce this year, I do want to start working and trying to figure out what the balance of that and what that might look like. I'm not sure yet. I have some ideas, but I haven't figured it out. So here I am at 54, still figuring out life. And I think that's just the way it is for all of us. Your challenges might look very different than mine, but they're no less hard. We all have different levels of hard, and mine have been physically taxing, but I'm still here. And I'm very happy to be at a place that my heart is stable enough that I can now consider some skin removal. So that's what my next Sunday Summit's going to be. It's going to be about the process of choosing a surgeon, where I'm going, the prep for that, and I hope you'll come next Sunday, and we'll climb another Sunday Summit, and we'll talk about that process and see if that shares any nuggets about resiliency and facing fears, because I'm going to show you actually the skin that I am left with now, and why I'm addressing it. And I hope that interests you. So I hope you pace your heart this next week and you enjoy what's on board for you. Thanks for coming out and sharing this journey with me.